All right, well, raise your hand if you suffer from any of the following: chronic headaches, lower back pain, joint pain. Well, forget the usual solutions you get at the pharmacy, because there are safe and natural ways to relieve that pain. We're pleased to be joined once again this morning by natural health care expert Dr. Mark Mincolla. Mark, great to see you again.
Great to be
Appreciate
here,
you coming in. Chronic pain, kind of a growing industry, isn't it?
It's certainly a growing problem, Gene. 50 million Americans, costing us $100 billion a year in productivity. There are natural solutions.
Some of us think of chronic pain. We think we have it. We may not know we have it. So let's start by defining chronic pain.
Well, Gene, it's any pain that exists for longer than 3 months. So 3 months or more. Doesn't have to be continuous,
right,
but that long-standing pain that kind of waxes and wanes, that's chronic.
And this is something that you've had repeated issues with over there. You know, backache is always there, and maybe goes away, comes back, that type of thing.
Backache, headache, osteoarthritis, knee pains.
All right. And when people try to relieve this on their own and they go to the pharmacy, what are the common medications people usually turn to?
Well, the non-steroidal anti-inflammatories, Gene, the Motrin, the Aleve, the Advils, the Bufferins, the Aspirins. A lot of folks get a lot of stomach upset with that. Some folks, ulcers, so they got to be careful. They got to be looking for natural solutions. There are plenty of them.
And we have them, which is why you're here. So let's talk about some of the food, natural food remedies. What kind of foods can help? And I guess, are these specific to certain types of pain you have, or would this relieve almost just about anything?
No, they're generic, and they're kind of general, broad-based, because when you think about pain in the body, it's a matter of what we see. Tart cherries, for example. The University of Michigan's done a lot of research on those. They can cut pain as much as 50% from their study. Celery has 25 different anti-inflammatories. The University of Illinois has done a lot of work on that. The French have done a lot of research on avocado. The fat in avocado, they say, increases our ability to absorb the omega-3 anti-inflammatories from fish oils by 15 times. Ginger, of course, has been used a lot over the centuries in Chinese medicine, but recently the University of Georgia has done a lot of great ginger research and found that they're able to reduce osteoarthritic knee pain by 25%. Turmeric's been studied extensively, University of Arizona College of Medicine, and again, it produces and it triggers the production of anti-inflammatories called COX-2 anti-inflammatories.
Let's talk a little bit about a couple of these, specifically the avocado. Yeah. If you're having some guacamole with your chips, is that going to help you in any way?
Yeah, indeed. I mean, I think the whole concept here is there's good fat in there, and again, over in Europe right now as we speak, there's a new medicine that's all the rage, and it's a combination of avocado fat combined with soy fat. And the two together apparently have this ability to, again, increase dramatically our absorption of the omega-3s, which are the key anti-inflammatories.
And how you take this stuff, like people hear ginger and they say, oh, maybe ginger ale will work.
Right.
But how do you take, when you talk about this stuff, you have to eat it raw? Can you put it in other foods? What's the best way to ingest this stuff so it does the best job?
Well, first of all, these studies indicate that it's accumulative. So I think the real key here, Gene, is the diet has to be really rife with fruits and vegetables and a lot of these great spices. It's accumulative. We build up these antioxidants. Our body's going to make good use of them long term. It doesn't require overdosing or any of that business in pill form. I think it does help to have teas, like we talked about ginger tea, for example. Put turmeric and curry in your spices and your rices and your chicken dishes and things like that. But it's accumulative. I don't think we have to go overboard. So
people who say, all right, I got a backache, I'm going to have some celery and it'll go away, that's not going to be the case here.
No, it's really a matter of, again, changing that diet around, making sure that those healthy fruits and veggies, again, we say healthy because now there's so many new properties like anti-inflammatory responses we're finding more and more every day. Build up that natural healthy diet because the benefits, of course, extend into the area of pain and inflammation.
And we talk about how much of this stuff to ingest and to have in our diet. Do you need to increase from what the normal recommended serving size is, or if you just stick with what is recommended and stick to that, then you'll get the benefits?
Well, I think, first of all, those recommended doses have gone way up. Those serving sizes of fruits and vegetables are increasing dramatically because of what we're finding. And again, you're getting fiber, you're getting vitamins, minerals, a lot of great stuff. But really key here is the natural COX-2 inhibition or the anti-inflammatory response. Our body basically will really take to producing higher levels of these anti-inflammatories within itself with the encouragement of these food chemicals.
So over time, you're going to be helping yourself even more and more.
Absolutely.
And lastly, with some of these things, the tart cherry, celery, avocado, that's easy enough for most people. But people look at the ginger, the turmeric, and they say, okay, now, well where do I get that? I mean, can I find it? Is it readily available?
Well, it is. I mean, first of all, ginger is a great spice to add to things, but also, ginger tea is terrific. A little bit of honey, a little bit of ginger tea can go a long way. Turmeric, of course, a lot of curry dishes, a great way to get it. You can actually take these in capsule form from the health food stores as well. Generally 500 milligram capsules, pretty easy to find and easy to take, safe and effective.
You find people wind up doing that more than actually increasing their diet and eating better?
Well, you know, I'm finding more and more people with chronic pain and inflammation problems are really going this route, and really we're getting great results. I see empirically in the work that I do, astounding how effective it is.
And you've talked about some of those other over-the-counter medications. There are some side effects there, especially if you take them repeatedly. And you've got to be careful about that, because there have been some very sad stories that result from that. For more information on all of this, and you want to improve your natural healing or help your body heal itself, you can visit maxhealing.com. That's Mark's website. Got a lot of great information on there as well. So always, Mark, we appreciate it.
Thank you, James.
Great to see you.